Classification. It is classified based on location to two types: anterior crossbite and posterior crossbite. Single tooth anterior crossbite. This is segmental anterior crossbite. Then coming to posterior crossbite. Posterior crossbite is divided into unilateral and bilateral. This is unilateral posterior crossbite. This is bilateral posterior crossbite. Based on nature of crossbite, it is classified into skeletal crossbite, dental crossbite, functional crossbite. The functional crossbite is due to the occlusal interference leads to displacement of mandible anteriorly or laterally to achieve maximum intercuspation. Etiology. Persistence of primary tooth in maxillary arch causes palatal diffraction of erupting successors. It leads to anterior crossbite. Coming to lip biting. Lip biting habit leads to anterior crossbite. Now coming to habits. In normal tongue position, tongue rests on palate. But in habits like mouth breathing and tongue thrusting, tongue is placed in lower position. Due to lower tongue position, there is disharmony between internal and external muscle forces and causes narrow upper arch and lower anterior proclination. Next, retarded development of maxilla. Retarded development is seen in various genetic disorders like Crouzon syndrome, Apert syndrome, Down syndrome. The videos of Crouzon syndrome, Apert syndrome, Down syndrome are given in description. Decreased growth stimulation in mid-palatine suture may cause crossbite. This is normal palate. The underdeveloped palate is due to the decreased growth stimulation. Cleft palate. Unilateral or bilateral cleft palate may cause anterior or posterior crossbite. Treatment plan. For anterior crossbite, especially single tooth crossbite, tongue blade therapy is used. Mandibular anterior teeth is used as a fulcrum. It is used daily for 1 to 2 hours for nearly 2 weeks. For segmental anterior crossbite, Catalan's appliance is used. Catalan's appliance is fabricated using acrylic or cast metal. It has 45-degree angulation. It causes forward movement of maxillary anterior teeth. The disadvantages are speech problem, needs dietary restriction as not to eat any hard foods. It needs frequent re-cementation. If we use more than 6 weeks, it causes super-eruption of posterior teeth. Z spring are also known as double cantilever spring. It needs adequate space for forward tooth movement in anterior teeth. The fabrication of Z spring is given in description. Patient during growth period. Reversible headgear is used for hypoplastic maxilla, and for hyperplastic mandible we can use chin cup. Fixed appliance is used when there is crossbite involving more than one teeth and in case where crowding and rotation needs to be corrected. Night eye wires or multi-loop arch wires can be used along with bite plane. As we know that lower anteriors prevent forward movement of upper anteriors, so that lower posterior bite plane is placed. It keeps bite open. It causes forward movement of maxillary anteriors, and due to night eye arch wires, it causes correction of crowding and rotation. Another method to open bite is placement of GIC filling on occlusal surface of mandibular first molar. It keeps bite open. It causes forward movement of anterior teeth and also corrects malocclusion. Next, coming to posterior crossbite treatment plan. For single tooth posterior crossbite, we can use crossbite elastics. Crossbite elastics are placed one on the lingual side of maxillary posterior teeth and other on the buccal surface of mandibular posterior teeth. It should not be continued more than 6 months. Next, coffin spring. Coffin spring causes slow expansion of maxillary arch. The video for fabrication of coffin spring is given in description. Coffin spring causes maxillary expansion. Van helix. Van helix causes slow maxillary expansion. These are especially used in non-growing patients. Next, rapid maxillary expansion. Rapid maxillary expansion devices like Hyrax can be used for rapid expansion, especially in growing individuals. Removable appliance with midline jack screw used in case of bilateral posterior crossbite. Then coming to removable appliance incorporating jack screw, which is used in case of unilateral posterior crossbite. Jack screw can also be incorporated with fixed appliance along with expanded arches or crossbite elastics.